I'm here with Dr. Tiffany Sauls, founder of Asheville Integrative Psychiatry today to learn about nature therapy. Dr. Sauls, what can you tell us about nature therapy?
Nature therapy, also known as ecotherapy, ecopsychology, it's a field of therapy that brings the environment and the natural setting into the healing component. And so therapists might encourage or do sessions outdoors, encourage clients to spend more time outdoors, noticing, engaging all of your senses, and bringing different components of connection to nature into the healing process.
And so what are some of the benefits that people might experience?
Nature therapy, gets people outdoors and disconnected from technology in a way that can be incredibly helpful for the healing process. And so, potential benefits, decreased stress, decreased anxiety, decreased levels of depression, increased feelings of connection, increased compassion, increased awareness, and there's physical health benefits as well.
So are there types of personalities or maybe diagnoses who benefit more from nature therapy?
Folks who are engaged in more of like a high productivity kind of lifestyle, always on the go, working long hours, feeling anxious or stressed or overwhelmed or burnout even. Those are the folks that probably benefit most. It's such a change of pace and environment, and a chance to slow down, drop in and connect to a natural space and find resource from the environment that we don't get elsewhere.
I feel a little convicted by that. I certainly had those same types of emotions when someone mentioned nature therapy to me the first time. I was like, I don't have time for all of that. What else are we going to do? But I think that it was probably good medicine at the time, and I needed to be a little more aware and a little more receptive to it. So how are you able to help people build their connection to nature?
Different ways. So we do specifically nature therapy here, and so most of those sessions will happen on the land and outdoors. We also build nature therapy into our ketamine assisted therapy program, and so different components of nature therapy are built in there as well. And so that might be spending time on the land, developing what's called a sit spot practice, which is taking maybe even just 5 minutes a day, going outside, leaving your technology indoors, working on like a mindfulness practice. So engaging each of your senses, listening to what's going on, birds, crickets, testing, the feeling of the air on your skin, or what do you smell or see. So engaging all of your senses in a mindful practice outdoors, that's one thing that we encourage clients to do. And then there's other things such as like all walks. And so that's like walking outdoors as if it's the first time you've been in the space. And we do take clients on all walks here. We provide some forest bathing sessions, which is a more intensive drop in to nature therapy. And that's an evidence-based treatment for chronic stress. And through the process of doing forest bathing, folks actually have reduction in cortisol levels over time. So it's an effective treatment for stress.
So walk me through that. If I'm here for therapy and I'm out on the property, what is that like? What's going on? What's the interaction between the therapist and the patient?
Yeah. So if you're here to engage in nature therapy, we have one therapist who provides that. Her name's Erica, and she will meet you outdoors, rain or shine. So come prepared for the elements. And she will guide you in probably a meditation or mindfulness early on, to drop into the space, to regulate your nervous system. A lot of times we're, always just moving too fast and driving too fast to get here. And so dropping in and regulating your heart rate and your breathing, and finding resource and calm from the environment here. And so then, there's components of traditional talk therapy, but there's also guided meditation, mindfulness. You may go for a hike, look at metaphors in nature of where, say, a tree was struck by lightning and there's trauma, but it's regrown stronger or in a different direction. So looking for metaphors in nature, that's something that happens in sessions.
Okay. Yeah. And your practice in nature therapy, is it usually a standalone or is it combined with other treatments?
Nature therapy can be standalone, and we do have clients who come here just to do nature therapy. We also incorporate nature or support increased nature connection in the process of our psychedelic assisted therapy with ketamine. And we include some guided nature connection through integrative psychiatry as well. So it's incorporated into all the different components of our practice.
Okay. And what advantage do you feel like that offers compared to a traditional setting, like an in-office setting?
So you're asking about the advantage of doing therapy maybe outdoors versus in office. And I would say a lot of people struggle with traditional talk therapy. So sitting down on a couch in an office and just sharing, like that's a really uncomfortable space for people, for some people. They don't really know how to access any like feelings and emotions, and it's really difficult. And so coming out here into this beautiful natural environment, spending time on the land, feeling resourced and connected to, the wildlife or the plants or the trees or the sounds, it allows for maybe easier access to some feelings and emotions, to be able to bring those out, and maybe feeling more resourced in your ability to address hard emotions.
So what can you tell me about the importance of establishing a nature connection?
So nature connection, there is a scale that's kind of newer. It's called the nature relatedness scale in R6. And in research, particularly with psychedelic medicines, we've looked at how people's feelings of nature connectedness, nature relatedness, influence psychedelic experiences and outcomes, and vice versa. So the effects can go both ways. And psychedelics themselves can create an increase in feelings of nature relatedness. Those feelings are part of the healing process in terms of stepping out of more intensive symptoms of depression or trauma. You feel a greater connection to the world as a whole, the environment, the community, so increased feelings of connection. There's also increased feelings of well-being or decreased stress if you have greater connection to nature. So all of those are important components in the healing process.
So what do you see people take away from their nature therapy session?
I think that, coming out here to AIP, 16 acres of beautiful retreat space. I was told recently that this is the only doctor's office that one of my clients really is excited to come to. And so being out here for nature therapy or for any appointment is the opportunity to unplug, to get away from just the hustle and bustle of what's going on in day-to-day life, to connect both to the land and to to the staff and therapists here, and to slow down. And so knowing that you can access that here and other places in your life is a helpful thing, helpful knowledge to have.
Well, it really is a special place for sure.
Mm-hmm.
So what advice would you give to someone who feels like maybe they don't have time for nature therapy?
If you don't have time and you're suffering from, say, depression or anxiety, then you might want to look at what do you have time for, and what are your priorities, and what's important, and what's motivating you to seek treatment in the first place. If you're looking for healing and wellness, how do we support you getting there? And we know that enhancing connection to nature is one of the ways we can support you getting there, but it's not the only way.
Well, it's been really interesting to hear about it, and I certainly have developed a new appreciation for it. In fact, in some of my own reflection, I realized that in times of trouble or when I'm bothered by something and need to think it through, my default is to go outside. But I never really put two and two together until I started to consider the benefits of nature therapy. And I'm glad that it's something that's available here. So thank you for sharing with us today.
Yeah.
All right.